안녕하세요, 여러분. Hello, everyone. Ciao a tutti. Once more, you're welcome back to Oma MJ's World. Yes, where I give you all the news from South Korea. So, guys, once more, you're all welcome back to my live stream. And in today's video, I want to talk about something very important, which has been disturbing me for quite a while now, and I thought it wise that I should share with you all so that you can also probably give me your opinion about it and we all can learn. But first of all, I'll say disclaimer. Yes, I'm disclaiming because this is not my write-up. I just did my research and with my own personal experience about it. So yeah, I've had a few people back home, like they tell me they are pregnant but they're not yet ready to go to the hospital and they prefer taking herbs. Yeah, like they say in pidgin English, I dey go for money. Like I don't know what people really think. Like you're pregnant, you have a fetus growing in utero and you don't want to go to the hospital. Why? I don't know. Maybe they think probably the herbs are preferable because that's what our parents usually use back home. So I really want to talk about antenatal care. Yes, because when you are pregnant, that is the first step you take at the hospital. Like that's the first thing that you should even do, not going to probably a herbalist to get some herbs and all that. So I was quite worried because it has happened to so many people I know around me that they wait until their pregnancy is like 4 or 5 months before they start going to the hospital. So it's quite disturbing because this is the technological era where everything has changed. Back in the days you could get pregnant and you stay at home for as long as you want and you go to the hospital and give birth like a Hebrew woman. But with this new era, people go to the hospital as early as 6 weeks. Yeah, because myself, that's when I found out I was pregnant, when I was already 6 weeks gone with MJ. Hi, Dr. Sheila. Hi, Mama Shantu. Hi, Cherubel Jean TV. You're all welcome to this part of my live stream today. As I was saying, I would like us to quickly talk about antenatal care or prenatal care. Depending on which part of the world you're coming from, they might call it antenatal or prenatal. So if you can understand what I speak, it means we are speaking the same language. Okay, guys, so let's dive into it. Please, before I continue, if you know you haven't supported my MG, what are you waiting for? Click on that subscription button. Click the notification bell to give you the alert each time I am up or each time I post any new video, guys. And if you enjoy this educational video, please do give me a thumbs up. Thank you. All right, so let's dive into it. What is antenatal care or what is prenatal care? Like normally I was supposed to put this out in in PowerPoint, but I don't have time. I'm a mom, always busy, and I tend to forget some things. So I just have a little jotter which I made some notes. Like I earlier said, disclaimer, this is my personal experience, and of course I've done my own research also. So guys, what is prenatal care? This is care that you receive while you're pregnant. Yeah, it includes a combination of visits, screening, and diagnostic tests. That is probably ultrasound. You could call it ultrasound or echography. Yeah, and you could also you would get counseling, educational support, emotional support, and of course social support. And lastly, fetal monitoring, which is the most important part of the story. Fetal monitoring. And of course, those of you who do not know me around the world, I am a nurse by profession, so that's why I always like sharing health related topics on my YouTube channel. All right, guys, so like I was saying, um This antenatal care is a combination of visits that you would do throughout your pregnancy, and it includes counseling, diagnostic tests, and of course education, support, and fetal monitoring, like I earlier said, which is really important. Please guys, you just have to follow me along and take note of the things I'm saying, you know. Yeah, baby. Yes, Appa is calling for you, right? Yes, go to Appa. I'm coming, okay? Okay, guys. So, the fetal monitoring will include the fetal growth, fetal heart rate, and maternal blood pressure. And yeah, mama. And screening. Yes, it's okay. Mama is doing a live video. And of course, screening for signs of premature labor. Okay. So I'll advise, when you discover at home that you're pregnant, and it's okay, go first to Appa. Let me finish, okay? I'm coming. Take, go and give your father. Go and give Appa. Thank you. Jordan, say good. Good girl. Okay. All right, guys. So as I was saying, you would want to start your antenatal as early as possible. Like the moment you discover at home that you're pregnant, I would suggest that you go to the hospital, start your antenatal, and follow up your pregnancy, so that in the end you won't say, had I known, I would have started antenatals early. Okay, guys. So, what do you expect? What you would expect when you go for antenatals? What are the things that you're going to expect from the 6 week? That's when you discover that you're pregnant. From 6 weeks to 12 weeks, you have a collection of demographic data. That is a detailed history of your family, possible tests, yeah, and you do ultrasound, of course, that they will have to confirm how far you've gone with your pregnancy. And of course, you also do a blood test, and they will start a blood pressure control at once, yes, during your antenatal visit. And also your weight will be taken, your urine will be taken to test for protein and sugar in your urine. And from the 12 to the 16 weeks, that's 1 month later, it's almost the same thing, where they'll test your blood pressure and they'll test your weight. They'll check your weight, sorry, and they'll also check your urine again for protein and sugar. Like, this is just the routine that they always do when you go for antenatal visits. And of course, from the 18th to the 22nd week, they'll check the fundal height. Yes, the height of your fetus. And of course, they'll check the fetal heart rate. Okay. I think the fetal heart rate differs for boys and girls. Yeah, like for my case, they say girls do have a higher heart rate. I don't know, but I'm not too sure about that. Yeah, lots of stress. Oh, lots of tests. Yes, they do a lot of tests when you're pregnant. So you have to be so prepared financially and everything. Yeah, that's the worst part of it, financially. Okay, guys, let's go to the 22nd to the 26 weeks, and of course 26 to the 30th week. They will do the same test they have done previously, and at this time they will check you for edema, that is the swelling of your hands and your feet. And from the 30th week, you start going for frequent visits. And from the 22nd to the 36 weeks, they will start checking your cervix. Yeah, these are just clues of what you can get when you go for antenatal. And from the 36th to the 40th week, you start going frequently. So that they will prepare you for labor and delivery and all of that. Jordan, what is it, Mama? It's okay. Come now. Come and join the live. Come. My mother wants to join this live. Oh my goodness. Okay, guys. So what's important on this what is that thermometer? Go and give Papa to check your temperature, okay? Good girl. Okay, guys, so as I was saying, sorry for the interruption, MJ is always by my side. Let's get to the most important part of it. Why is antenatal or prenatal care important to you, the woman and the man? And of course, when you want to start your prenatals, you need to go with your husband, because the demographic data they will take is both for the wife and the husband. So husbands, don't allow your wives to go alone to the hospital. I know you're working, but create time to go with your wives to the hospital. Maybe, I don't know, but just create time, because you don't know what that woman is going through. At this point, she needs all the emotional support. Yeah, she needs it. Okay, guys, so let's get to it. Why is prenatal care important for you, the woman and the man, including your baby? It will give you the opportunity to learn about your pregnancy and develop a plan. Yeah, because when you go to the hospital and they tell you you're gonna have a baby girl or baby boy, it starts preparing your mind already for the things that you can buy, and it helps you to plan your budget also. And as time goes on, they'll tell you if you need a surgery. So all those things are important that you need to know during your prenatal visit. So you have to go for prenatals. And also, it is important because it reduces the risk of complications during your pregnancy. They say prevention is better than cure. So it helps you to know about your pregnancy and prevent any complications that might occur along your pregnancy. And also, it will help you to get immunized. Yeah, there are some vaccines that they give to pregnant women while they are pregnant, and that is, how do I put it? It acts as a defense mechanism. Yeah, it acts as a defense. Thank you, Mama. Thank you. Go and keep it. Go and keep it in the room. Okay. Yes, it helps you and that's the vaccine you take during your pregnancy. It sets a defense mechanism, or it's like the antibodies will pass from you to your baby, thereby preventing your baby to get uh, um, some fetal defects. So going for antenatal is very important. And also, it helps you to get accurate nutrition. Yeah, because during pregnancy your nutrition has to change. Yeah, everything changes because you're not eating for one but for two. So it is important you learn about. It's okay, I'm coming. Babe, please come and take Jordan. So it is important for you as the man and the woman to know about the woman's nutrition, that the woman gets to learn to know what to eat and what not to eat. So it prevents all the birth defects for the baby. And of course, you will keep a track of development of your baby. Yeah, because if you don't go for prenatals early, like, you don't know if your baby is gaining weight or not, you don't know if your baby is growing well, you don't know if, like, because when you go for prenatals they do echography from time to time. That's ultrasound. They do ultrasounds from time to time. So if you do not go for antenatals, you will not know if something is wrong with your baby. So I would advise my fellow women, my fellow men, brothers and sisters, my moms and dads, please, if when you discover you're pregnant, it is very important that you start your antenatals as early as possible. And lastly, you will get to have classes. Yes, and you go for antenatal classes as well, and you will meet other women who are going to share their experiences with you, like, oh, during my first pregnancy I experienced this, I experienced that. So it is very important that you go for antenatals. Like, in my case, we started as early as possible, and of course in Korea you go every month. Sometimes I was like, oh my goodness, I don't want to do ultrasound because the money is too much. Like, I was thinking about the money because at that time we're not financially really stable, but now at least things are getting better. And I really advise all the women, as soon as you discover you're pregnant, please try to start your antenatal. So this is just what I wanted to share with us all today. I hope this video helps somebody. Please share the video, like the video, subscribe to my channel, and of course the notification bell to give you the alert each time Omar MJ is up with a new video. Thank you to all those who have been watching. Nomu kamsamida. How do you say? Grazie mille. Ne? Grazie mille. Okay, I'll leave you guys for now and see you in my next video. Ciao, 안녕히 계세요.